So oncofertility refers to the management of people who are experiencing some form of cancer and are trying to obtain eggs or sperm or embryos in advance of some sort of toxic therapy that might damage their ability to have children naturally. There are many, many different things that can do that. Most of them are fairly obvious. Like if you remove somebody's ovaries or remove the testicle prior to a cancer, this would seriously compromise somebody's fertility. But there are less obvious ones, like chemotherapies that might damage the ovaries or testicular function, or radiation that might damage the uterus for carrying a pregnancy. These would all fall under the auspices of oncofertility and need to be addressed. Many of them need to be addressed acutely, and some not so acutely. I would refer to them as subacutely. But all of them are urgent and can be managed. Subacute refers to something that is urgent but doesn't need to be done today. The best way of thinking about it for me is the difference between liquid cancers, for example, and solid tumor cancers. So in a solid tumor cancer, they tend to be more indolent. They grow more slowly. And that gives the patient a little bit more time to respond to it. Whereas liquid cancers, things like leukemias, lymphomas, tend to be very aggressive and can demand an intervention immediately. If it is so acute and so immediate, it may preclude us from being involved in oncofertility. For women, the most common thing that's discussed is to get eggs. In general, women ovulate 1 egg a month, right? So if you were just to get lucky enough and she was mid-cycle, you could go in and maybe retrieve that 1 egg. But in general, that's not what we do. We usually spend a little bit of time to give her a medication that comes in the form of shots that she takes, much like insulin, it's just below the skin. She might take those medications for up to 10 days or so, and then we would do the retrieval. The retrieval requires a little bit of anesthesia. It's not like they put a tube down your throat, it's anesthesia in your arm, more like what you get when you get a wisdom tooth removed, but nonetheless it's anesthesia. And then through the vagina, you can thread a needle into the ovary directly. It's not like it goes up to the uterus, out the tube, and down to the ovary. No, it goes directly into the ovary, and we can drain the follicles that grow in response to the medication and tease out eggs, and then freeze them.